We're aware of one child death that a coroner reported as could have potentially been preventable if there'd been adequate numbers of paediatric haematologists within that unit. It's very scary knowing that you can't provide the level of service that you are wanting to deliver, and knowing that patient safety is ultimately compromised. And also there's a degree of a vicious circle, because people who are potentially thinking of coming into the speciality get a very poor experience, and it puts people off the training.
Partly because of the increased stresses of working in a very hard-pressed NHS, increasing numbers of people going to less than full-time working. There's absolutely no point pouring more and more and more medical students into the top of the bucket if everybody's going to leave, and leave quickly within the first sort of year or two of qualifying. And at the moment we are facing a real challenge of unhappiness in terms of our junior doctor workforce.
We are not giving the care that we want to give, and that seeds in a feeling of dissatisfaction in the day-to-day job. And to me, I think it enhances the retention problem, which, as you know, in the NHS is a major concern. We're losing not only the most senior people who have a little bit had enough of the strain, but we're losing very young colleagues as well, because they're migrating elsewhere.
We've seen no increase in our haematology nurses workforce for the last 10 years, and that is despite the fact that our haematology patients over that time period are surviving longer. So we're getting all the new diagnoses per year, but in addition to that we're seeing ever increasing numbers of patients surviving for longer and longer and longer, and they will still stay on your caseload as a clinical nurse specialist.
We're seeing very high levels of sickness at the moment as well, lots of people that are not able to work nights for health reasons. So yeah, lots of impact, and it's often a decreasing spiral, isn't it, in terms of if people aren't happy in their work, then they don't tend to stay, and they don't tend to work more hours.